Live from the News Center, this is News Channel 8 Today, on your side.
A key to winning the battle against breast cancer is early detection, and now new technology in the Bay Area may help. Coming up next, Gail Guayardo shares her experience with a breast MRI.
State-of-the-art technology to better screen for breast cancer is at Memorial Sloan Kettering in New York. But what you might be surprised to know is the same technology is available here in the Bay Area. Doctors at Tampa's BayView Radiology actually stay in constant contact with the Kettering team. This morning, find out more about this new super tool to fight a disease that affects 1 in every 8 women. Most women turn to mammography in hopes of detecting breast cancer early. Radiologist Dr. Cousins says it's the best option available for most women, but the screening results don't always give a clear shot of tumors. He explained, showing me 3 different screening results from 3 different women. This is one from a patient with denser breast, common among younger women.
You see all of the white tissue represents fibroglandular tissue, and cancer on a mammogram is white as well. So it's like looking, our walls are green here. It's like putting a green spot on the green wall and trying to find it.
The next is a screening of a woman with silicone implants. This is called a pushback view, where the technician tries to take the tissue off the implant. There was also a screening of an older patient where the breast is made up of a more fatty tissue, where doctors could get a better look. But doctors like Alan Cousin hope one day more women will have access to this, a breast MRI, where the images are so advanced you can see them in 3D.
And we can rotate that and we can see the cancer right there.
It's technology that could help so many women find cancer at its earliest stage.
There are cases where you can't see the cancer on the mammogram. You can't see it, or at least it's very difficult to see sometimes on the ultrasound, so and you can't feel it. So you have our most common ways, or the traditional ways, of looking for a cancer that you can't see it.
Tonight on News Channel 8, I undergo a breast MRI screening. I will take you step by step in understanding the state-of-the-art approach to fighting a deadly disease and explain the experience of going into the magnet. My story airs tonight at 5, and I also wanted to point out that a lot of people are scared of closed MRIs. Well, I am someone who doesn't like tight quarters, but you are so comfortable during the exam with a warm blanket and earplugs, I actually fell asleep. State-of-the-art technology to better screen for breast cancer as at Memorial Sloan Kettering in New York. But what you might be surprised to know is the same technology is available in the Bay Area. Doctors at Tampa's BayView Radiology actually stay in constant contact with the Kettering team. This morning, find out more about this super tool to fight a disease that affects 1 in every 8 women.
Breast cancer affects 1 out of every 8 women. With statistics like that, it can be a frightening experience for any woman to get their baseline screening for breast cancer. Most women turn to mammography, but there is new technology available to women, breast MRI. Tonight, News Channel 8's Gail Guayardo wants to take you along on her personal journey at BayView Radiology in Tampa.
With prescription in hand, I walked into BayView Radiology very apprehensive. I'm at high risk for breast cancer. My mother is a survivor. And on this day, I'm trying technology that can give one of the most comprehensive screenings, a breast MRI. MRI technologist Adrienne Sajecki took me step by step prepping for the screening. First, she placed an IV line because part of the exam involves running contrast media through your veins. It was painless. Next came a warm, comfy blanket and earplugs. It's key to be comfortable so you don't move. As the table slowly drew into the magnetic field, I closed my eyes and just listened for cues.
Gail, can you hear me? Yes. Okay, the first one's going to be really short, less than a minute long.
BayView Radiology used specialized breast coil for the clearest picture, comparing its crisp imaging to a high-end plasma or high-pixel digital camera. Only 1 breast is screened at a time to reveal even more details. The entire process only lasts 20 to 30 minutes.
Okay, you're going to feel the table move slightly. This next one's going to be for about 2.5 minutes.
Toward the end of the exam, the contrast media runs through your veins and the machine takes rapid-fire snapshots every minute to capture how the contrast distributes through the breast. Every step I experienced at BayView Radiology here in Tampa is modeled after one of the most successful MRI programs in the country, Memorial Sloan Kettering in New York.
We are connected to Memorial Sloan Kettering. We use the same techniques. We have the same magnet. We're in touch, radiologist to radiologist. We're in touch. Our techs are communicating with their technologists.
Dr. Alan Cousins is a top radiologist and the medical director at BayView Radiology. He says this technology is so advanced, doctors can even view it in 3D.
We can rotate that and we can see the cancer right there, or if that's that mass.
And when you compare MRI results to the more familiar mammography screening, you can clearly see who would benefit the most from the high-tech test. This is an image of a younger woman's breast, which typically has more glandular tissue. That type of tissue shows up white, and so does a tumor. So detecting the disease can be like looking for a needle in a haystack.
There could be a mass there sometimes that the doctor can feel that on the mammogram you would be scratching your head to try to find it.
MRI also gives a clear view for women with implants. This mammogram of a patient with silicone implants shows what's called push-back images. Dr. Cousins says conservatively, 40 to 50% of the breast tissue can be not visible.
We'll do an MRI in those patients and we'll see either more cancer in other parts of the breast that would completely change the recommended operation or therapy, or sometimes we'll see synchronous cancer in the other breast at the same time. There's a certain percent of patients who have cancer in the other breast that is as yet undetectable. We can go right into the same room where you had it and we can perform a biopsy in there and say what it is, answer the question, it's cancer or no cancer, confirm with the MRI the extent of the cancer. If we see one thing on a test, that might just be the tip of the iceberg when you're talking about cancer and you're trying to find the rest of the findings, which would be, has the cancer spread to other parts of the body? Does the cancer show up here? You put them together, you get the synergistic combination where now you're getting much better benefit for all of these patients than we had, before.
Gail Guayardo, News Channel 8. Fight against breast cancer is entering a new era. The technology now available for early detection is unparalleled. And this new system is available in Tampa. This morning in part 2 of my early detection series, learn more about breast MRI. And the reason for my story is to educate people. And of course, obviously doctors know that this is available in hopes that more and more women can have access to it.
Gail says she was relieved to find out that her results came out negative. She also wanted us to pass along that the experience in the closed MRI was comfortable. In fact, she says towards the end she fell asleep. You can log on to TBO.com keyword connect to read more about the procedure or send Gail your comments.
This is News Channel 8 Today, on your side.